Hello everyone. Today I want to talk to you a little bit about PMS and hormonal imbalance. And the reason why I want to discuss this with you because it is not uncommon that people come to me with this problem and then they are disappointed with the consultation. And the reason for that is because treating hormonal imbalance is not possible. And despite me explaining the physiology of it, it's not always clear. So I want to explain it again for all these people out there who think they might have a hormonal problem. It is actually important to understand the physiology behind it. So first of all, hormonal imbalance is not a thing. It is not a disease. It just does not exist. And if something does not exist, you cannot fix it. So if somebody's promised you to give you a nutrition advice to balance your hormone, to give you expensive supplements to balance your hormone, this is all marketing talk. It is not a thing, not a disease, therefore you cannot fix it. What's the physiology like? This is a menstrual cycle chart. Now it's not perfect, and I'm going to put this a little bit closer, but it's pretty much the gist of it. This is the beginning of your cycle. The middle, more or less, for people who have a normal cycle is when you ovulate, and this is when you get your period. At the beginning of your cycle, you start producing estrogen, and that's the red line. And when you reach a certain peak of estrogen in a normal functioning body, not everybody is like that, but in a normal functioning body, this triggers ovulation. You produce an egg, and the little follicle that has produced the egg becomes a thing we call corpus luteum. And that is the thing that produces progesterone. So in the second part of the cycle, you have your progesterone production, which is the blue line. And at the end of the cycle, both hormones drop and you have your period. So as you can see, we are imbalanced for nature, because there isn't actually any day of our cycle where we have the same level of estrogen and progesterone. And the reason why we don't take blood tests to diagnose this, because if I take a blood test here, I will have a result. If I take a blood test here, I will have another result. I will take your blood test here, I will have a different result. So it is not possible to diagnose a hormonal imbalance because your hormones are always imbalanced. Okay, so this is the physiology of it. And what happens with people with PMS or PMT symptoms is not that they are imbalanced, they're exactly like everybody else. But unfortunately, they suffer much more for this variation of hormonal levels that we all have. We have a receptor for hormones in every single part of our body, but we don't all have the same level of receptor, and we don't all have the same level of sensitivity. So if you're a little bit unlucky, you have a level of sensitivity that it is higher, or maybe you have more receptors. So when this hormone level change, you suffer more than somebody else. And the symptoms you have will depend from where the receptors are. So for some people it's breast tenderness, for some people it's mood symptoms. We have a lot of hormone receptor in the brain. Look at what happens with menopause. So we do have different side effects for this variation depending on our own make. Okay? It sounds very unfair. I know I didn't design the woman's body to be like that, but that's the way it is. So if you have PMT, you can do a few things. Thing number one, you can learn to live with it. If you don't want to take anything, you know when your variation do happen, you know what symptoms you do have, and you can learn to take a lot of self-care in that particular time when the variation happen. And for some patients, this is just enough. The second thing you can do is take the contraceptive pill. Because when you take the contraceptive pill, you don't ovulate anymore. So instead of having this, you have two steady lines. Okay? So then your hormones are all pretty much the same and you don't have the variation. And that is why combined estrogen progesterone pill, it's a good treatment for PMS and PMT. Now, usually people who come to us for this do not want to take the pill. They might have side effects from the pill that are worse than their own PMT, and that's a personal choice. Unfortunately, some people don't want to take it and don't want to try because they think, oh, I'm taking hormones, this is going to make my hormone worse. And that is actually not right. I really think you should give it a try because you might find that you feel better. And taking it for 2-3 months will very quickly tell you. If you don't feel better and if your side effects from the pill are worse than the PMT, well, then it's your own choice to decide which one is worse for you. The third thing you can do is target individual symptoms with different drugs. So for example, if your mood symptoms are the worst, you can take antidepressants specifically for this. If your breast tenderness is the worst, you can take medication to reduce breast tenderness. If your fluid retention is the worst, you can take medication to target that. But there isn't a medication, unlike the pill, that will target all the symptoms. You need to decide which symptoms are worse, and we can target them individually. The fourth thing you can do is castration. And that was done in the past, and I haven't seen anybody having it done anymore, but it was done in the past for people with very, very severe PMT. So you take away the ovaries, all of that doesn't happen, and you don't have any symptoms. And that's usually not an option, especially for young patients. So that's what PMT and hormone imbalance is. And I think it's really important to reinforce that hormonal imbalance is not a diagnosis. So if you're coming to see me because you want to understand why you're imbalanced and you want to fix that, I'm sorry, I cannot do that. I'm a doctor, I only do medical treatment, and there is no medical treatment for hormonal imbalance because it's not a disease. So don't come and see me because you're going to be very disappointed. But if you want to understand physiology, if you want real medical help, if you want help because you want to have a baby, or you don't want to have a baby, or you have menopause symptoms, or you have perimenopause symptoms, and you're open to medical treatment, then I'll be delighted to help you. I hope this is clear for everybody, and please drop me your comments and your questions if you have any.